challenges of critical care are unique in the medicine, the physiology, the intense relationships you develop in a short period of time with the family. And all of those I really enjoy, and you really don't get that combination anywhere else.
I love critical care because you get to do some of everything. We see bad traumas, kids after neurosurgical procedures, burns, kids with congenital heart defects, and all sorts of others. So there's nowhere else in the hospital where you get that kind of variety.
We're a referral center for the state, and so our acuity is unmatched in the state. We don't have any competition of nearby hospitals. We see a lot of ECMO, which is something that I think is important in our training to become competent at, and acuity there, ICU naturally attracts. It's just a matter of experiences before you start getting good at it. I can speak out of personal experiences that things that I thought I would never understand are things that you have more than enough exposure to that they start becoming much more familiar very early in fellowship.
We're a busy center. We are the only place in the state of Indiana that can take care of the sickest kids. And I would argue that you need that as a fellow, and that's why I stayed, because you can't match this learning anywhere else.
Our fellows get a very unique opportunity to work in a busy, big unit while exercising their own autonomy. We do have safety valves in place to help support this, such as a cardiac ICU attending in-house all the time, so there is always somebody to go to for backup and somebody to call at home. Another unique thing about our training here and clinically is that our cardiac ICU lies under our division of critical care. So we think this gives our fellows a unique opportunity to work with our cardiac ICU attendings, not only in the unit, but also when it comes to research or journal clubs or morbidity and mortality. They have access to those attendings.
Where I've probably grown the most in my time here at Riley is in my sense of being a leader, not just in the ICU, but I feel like in the hospital. One of the biggest things that I've seen in myself is being able to walk into a room where things aren't going as planned or things may not be going well, and to be able to help people kind of find their purpose in the situation and to help make sense of it, and at the end of the day to get the child or the patient better that we're taking care of.
We advance our fellows' autonomy in a way that's unique here that they don't do at a lot of places around the country, so that they're in-house still sometimes by themselves at night. There is always a critical care trained doc in the cardiac ICU who acts as backup, and we have lots of really good support, but we try to get our fellows going and actually able to practice a little bit by the end of their first year. The other half of your time here is spent doing research.
We define academics very broadly. We want you to have something outside of the clinical arena that contributes, but it doesn't have to be bench science. We can support bench science, we can also support translational, clinical research, quality improvement, medical education, simulation. We've had fellows do all of these and have work that is publishable and work that gets them a job.
I was a physician scientist pathway and wanted to start my work in residency and continue going into fellowship. And so I think our research resources, especially for fellows, are unmatched. The ease of getting funding, especially as a trainee, unmatched from anywhere else I interviewed.
On my research, I'm interested more in clinical research and in improvement science. And so we have some really excellent mentors here who can help anyone who is interested in that. I've been able to present that work nationally, and it's going to be published soon, which is really exciting.
The engagement between the faculty and fellows here is really special. It truly is one group. They're not a bystander by any means. And with that, we treat our fellows and view them as junior faculty. So we expect a lot from them. We expect them to work hard, to learn, to grow quickly, but we also give them a lot of opportunity. I think that's something special at Riley.
We have really great relationship with our fellows, socialize with them a lot. There's always a lot going on in our office space with people walking around, talking to each other, chatting about personal or clinical or academic work. It's really a friendly environment. We have a number of social engagements in our division each year, some with just the fellows and some with the faculty fellows, nurse practitioners, administrative folks too. So we really try to create a family environment in our division, and the fellows are very quickly welcomed into that and really treated as junior faculty.
They really will do anything within their power to help the fellows here, whether that is research or clinical interests. or whatever you need to grow to become a better doctor. I think that the people really are what makes the experience here.
It's the people that kept me here. I didn't want to leave my people, both within these hospital walls and outside of here. And Indy is a great place to live. It's a great place to raise a family. I have a house, a husband, a child, and I couldn't have done those things and bought a house elsewhere.
The place is a really easy place to live. There's a lot of things to do if you're looking for music venues and comedy and sports and restaurants, but it also makes it easier than a lot of other large cities. Much more movable, affordable, less traffic. I think I'm in Indianapolis for the long haul.
Going to a place that's going to train you to be a good clinician and also give you the tools to be a leader within your unit and also the field is something that is invaluable. And I would pick this place 100 times over.